for joining me again to talk about a dental related topic. So today I want to profile a Waterpik water flosser. I've had many patients come in asking questions about whether they should be using a water flosser or if it's something that they should replace their regular flossing with. You know, they just want to know more about it. So this is what this video is going to be about. So basically I want to clarify that a lot of people refer, me included, guilty of it, refer to the Waterpik water flosser as just a Waterpik, okay? But just to clarify, the Waterpik is actually the brand name for the water flosser. They make all other types of devices and different products under the Waterpik name, but a lot of times people refer to the water flosser as a Waterpik, so me included. So guilty. So you may hear me say something about a Waterpik just because I am so used to referring to the water flosser as a Waterpik specifically. You may hear me refer to it in that manner, and I want you to know what I'm talking about. Basically, a water flosser is an oral irrigator, which is an at-home device that you would use. It uses water to flush out plaque and bacteria between your teeth and gums. It also gets slightly below the gum tissue and helps to keep everything nice and clean. It mainly focuses on your gum tissue. It's not really big on preventing cavities and things like that. It's to get your gum tissue to a healthy state and prevent any type of gum disease. So that's basically what an oral irrigator is. So there are certain people who I would recommend a water flosser to in private practice, different groups of people. The first group of people would be someone who has like braces or many, you know, more than one fixed bridge in their mouth, because a lot of times these types of appliances require that you use something like a floss sorter to get underneath the appliance, to where it just takes a lot more time, especially if you have multiple bridges and things like that, or you're having to constantly on a daily basis thread the floss sorter underneath the wires of braces. For teenagers, that's just not very smart to think that they're going to do that on a daily basis. I have so many teenagers come in with swollen gums because they just simply do not want to go through the effort of using a floss threader on a daily basis to maintain their gingival health while they're in the braces. It's impossible to use regular string floss, but it's just too time consuming for them, and they're just not simply going to put forth the effort to floss with a floss threader under each one of the wires to keep their gums clean and healthy. So basically people with braces, people with multiple bridges, and also for a patient who's just simply not going to floss. I have patients come in, they know the effects of not flossing, they're experiencing right here at this moment, but they're just are not interested in flossing. There's nothing I can say to encourage them to floss anymore. We've tried, you know, they're just people that will just straight up flat out tell you that I'm just not going to floss. It's not something that I want to do. So sometimes they may be more interested in using something like a water flosser to help to maintain their gingival, or to help to get them to a healthy state and then maintain their gingival health. So that would be another group of people that I would recommend the water flosser to. Another group would be patients who have gum disease such as gingivitis or periodontal disease. We've already done the initial treatment such as a scaling and root planing, which is a deep cleaning, or any type of gingival scaling and things like that. We've done the initial treatment, but the patient's gums are still very, very loose and not firm enough to really floss. It doesn't seem like floss is being very effective with removing anything because the gums are so swollen and loose. So I would recommend to that patient using a water flosser to get the gums to a healthy state to where they tighten up a little bit to where they can start to floss. The pocket depths and things like that that we measure with probing, if those get to a state of being a little bit shorter to where the patient can floss effectively, then that's what I would recommend the water flosser for, basically to get them to a state of healthier gums to where they can be effective with flossing on a daily basis. So and the last group basically would be patients with disabilities, someone who's maybe had a stroke or something, or other types of disabilities to where they're not able to really close their hands enough, or hold their hands tight enough to use regular string floss. Maybe they're able to grip a water flosser a little bit more effectively or easily, to where they can actually floss with that versus using regular string floss. It's better than nothing. I think that that's a good idea to help them keep everything nice and clean. So now that we've talked about the groups of people that I would recommend the water flosser to, I want to actually show you what the water flosser looks like, and also some of the accessories that comes with it, and actually show you how to use it. So if you're interested in that, stay tuned. So this particular water flosser model is called the Black Ultra Water Flosser. It retails for $59.99 on the Waterpik website. This is the top of the unit. It doubles as a storage compartment for the 5 tips that comes with the unit. And so you can place them in here just like this. This clear area, or this clear part, is the reservoir. You fill it up with warm water or lukewarm water, and that's where the water goes. This here is where the water flows through the unit from the reservoir. This is the handle. This button here is where you release the tip off of it. Helps to take the tip off. The other button right here in the middle is the pause button, so when the unit's turned on, it helps to pause the water from flowing out. The tip just snaps back on onto place. So it just goes back on just like that. So on the side, there are a couple of areas here. On the top, this is the on and off switch. On the bottom, this little turn area determines the amount of power that comes through the machine. It goes from level 1 to 10. So as I said before, there are 5 tips that are included in the box. These 2 are the Waterpik Classic Jet tips. They have different size openings at the end, which will help you to control the amount of water that flows out. These are just used for general use. They should be replaced every 6 months when used on a normal basis. This one is called the Waterpik Pickpocket Tip. It's used for periodontal pockets and furcations. It's used to deliver therapeutic rinses under the gum line, and it should be replaced every 3 months when used on a normal basis. The next one is called the Waterpik Orthodontic Tip. It's used for orthodontic appliances, just like the name, and dental braces. It should be replaced every 3 months when used on a normal basis. This next one is the Waterpik Plaque Seeker Tip. It's for implants, crowns, bridges, and other restorations, and it should be replaced every 3 months. The last one is called the Waterpik Water Flosser Toothbrush Tip. It is designed to let you brush and floss at the same time. So all of them just snap on just like this and can be released with a side button. Your first use, the unit should be plugged in. It should be turned all the way up to the highest setting, and then you should put the tip over the sink and press the button to start the stream. And then as the stream comes out, you'll turn off the unit. This is called priming the pump. On subsequent uses, you would plug it in as well. You would start on the lowest pressure setting, and then you would lean over the sink and place the tip in your mouth partially with your lip closed. You would turn the unit on and the water on, and you would press the button and use the flosser just like this. So basically when you're using the flosser, you're going to trace along the gum line between the teeth and along the gum line just like this. It's very easy to use. And you would also use it on the tongue side of your teeth. So published in the Journal of Clinical Dentistry in 2013 was a study that was done on 70 participants, adult participants. There were two different groups that were participating in the study. There was a group, a Waterpik Water Flosser group who used manual toothbrushing, and also a string floss group, wax string floss group, who used manual toothbrushing as well. Both groups used the Bass method of brushing, which is the circular brushing. So they did this on a daily basis, and the results were that the Water Flosser group had a 74.4% reduction in whole mouth plaque reduction, and compared to the string floss group, who had a 57.7% whole mouth plaque reduction. And so basically the Water Flosser was 29% more effective than the string floss to for overall plaque removal. So basically the conclusion was that the Waterpik Water Flosser and manual toothbrush is significantly more effective than a manual toothbrush and string floss in removing plaque from tooth surfaces. So, you know, that was basically the study that I guess that supports the claims to the Waterpik brand, basically saying that it's more effective than using regular string floss. I actually have different thoughts on this. My thought is basically that a Waterpik Water Flosser is good for reducing gingival inflammation or, you know, swollen gums. And it would be great if basically everyone was able to afford a water flosser and also regular string floss and use both of them every day. So in a perfect world, it would be great if everyone could afford a water flosser and a string floss, and they could use each one of them once a day. So basically morning brush, with the morning brush they would use regular string floss, and then with the nighttime brush they would use the water floss or something along those lines. But that's not very realistic to think that everyone can afford one, and you know, it's just accessible for everyone. So basically my thoughts are that a water flosser is good as an adjunct aid. So if you already own a water flosser or just are very interested in getting one, I would say use it as an adjunct aid to regular string floss, and don't just completely replace your regular string flossing with it. The reason being is that the water flosser basically helps to cater to the gums. It helps to get the gums and to a healthy state and maintain that, but it doesn't really get in between the teeth and hug the teeth like regular string floss does, in order to prevent against cavities. So I have to wonder how much of preventing cavities a water flosser does in comparison to regular string floss. So basically the study just talked about reducing, you know, gingival health and plaque and things like that, but it didn't talk about, you know, total cavity reduction and things like that for the people who use the water floss. I would recommend using both of them if you have one. I definitely wouldn't recommend replacing regular string floss with a water flosser at all. So I would say if you don't already have one, then I wouldn't necessarily go out to buy one unless you're a part of one of those groups that I mentioned before, such as having a disability where you can't hold regular string floss. If you have one or more bridges in your mouth or braces, if you're just simply not going to floss, I would recommend this to those groups of people who would benefit significantly from using the water flosser. So today, something to smile about comes from Romans 8:1-2, and it reads, "There is therefore now no condemnation for those who are in Christ Jesus, for the law of the Spirit of life has set you free in Christ Jesus from the law of sin and death." Now that's something to smile about. So I hope you found this video helpful. If you did, please do not hesitate to give me a thumbs up on this video. I'd greatly appreciate it. So I'm also interested in knowing how many people own a Waterpik water flosser or oral irrigator. If you do, or if you're interested in getting one, please share your comments down below. I'd be happy to read some of those comments and see what your thoughts are. If you're interested in more content like this, or have any suggestions on any videos and things like that, please subscribe and also leave a comment down below on any of the suggestions that you have. I'd be happy to see that as well. So thanks so much for watching, and until the next video, take care and remember to let your smile shine. Bye.